Hi everyone, it's my pleasure to welcome you all to my presentation about my PhD study, and I am very pleased to participate in this virtual scientific seminar 2020 in Australia. So first, let me introduce myself. My name is Nader Alotaibi, and I'm a faculty member in the College of Nursing at King Saud University in Riyadh, and I am a PhD candidate in the University of Adelaide in Adelaide, South Australia. I'm working under a supervision of Professor Gillian Harvey and Dr. Elizabeth Lynch. My PhD study is about the factors influencing intensive care nurses' adherence to prevention of ventilator-associated pneumonia, clinical practice guideline in Saudi Arabia, a mixed method study. So patients who are on intensive care units and require mechanical ventilation device are at increased risk of developing ventilator-associated pneumonia, which is called the VAP, which is a serious life-threatening condition. So patients who develop VAP, which occurs between 10 to 30% of ICU patients, have a higher of mortality and morbidity rates among all other type of patients. Also, VAP will lead also to increase the length of stay in the ICUs for those type of patients to up to 21 days. The estimated cost of caring for those type of patients is estimated to be between 40 to 65,000 US dollars per mechanically ventilated patient. Lastly, the VAP rates in Saudi Arabia is considerably higher comparing to other countries, and this is estimated to be between 9 to 40 per mechanically ventilate per 1,000 ventilator dependency days. The good news is that VAP can be prevented by good infection control and early weaning from ventilation. And for this purpose, several clinical practice guidelines have been developed within the aim to reduce the incidence of VAP among patients. Within those clinical practice guidelines, there are some recommendations that fall within the specific remit of nurses, which are the elevation of head of bed to 30 to 45 degree to prevent the aspiration. In addition, hand hygiene opportunities before and after patient contacts to prevent the infection. And lastly, the oral hygiene with 0.12% of oral chlorhexidine solution to prevent colonization of the aerodigestive tract. Nurses' adherence to these three recommendations is variable, and for this purpose, my PhD studies come here via three research studies. So in the first study, overall, I'm going to explore the level of ICU nurses to the three recommendation via three research studies. In the first study, which is a quantitative study, I'm going to assess the level of ICU nurses adherence to these three recommendations via two research techniques. The first technique is the audit of the current practice, and the second to survey ICU nurses to understand the factors influencing their adherence. The second research study is about to examine more in depth the factors that influence ICU nurses adherence to the three recommendations in Saudi Arabia via qualitative study. And lastly, the third study is to facilitate the development of future recommendations for the implementation of VAP prevention clinical practice guidelines in Saudi Arabia via group discussion. The interesting part of my PhD study is that my PhD study is the first study of its kind to investigate and explore the factors influencing intensive care nurses' adherence to the three recommendations in Saudi Arabia. In addition, the findings from my study will contribute to the nursing discipline by building the availability knowledge base about nurses' implementation of evidence-based practice. And lastly, my PhD study is significant for policymakers and administrators in Saudi Arabia because it will provide the potential to identify improvement strategies for improving the implementation of the clinical practice guidelines in general as tools to enhance evidence-based practice. Thank you so much.